welcome the Director of Michigan Programs for the W.K. Kellogg Foundation, Yazeed Moore.
Good morning. Again, I'm Yazeed Moore, the Director of Michigan Programs at the W.K. Kellogg Foundation. It's so good to see so many of you early this morning. I see that night at the stables or out in town didn't impede your attendance, so A+ for you. At the Kellogg Foundation, we're driven by the vision of a world where every child has an opportunity to thrive. Yet, the systems that affect most young children, food, health, education, and the economy are not working for everyone. And this has grave and lifelong consequences for children, families, and communities. With children at the center, our work supports community-driven solutions. We fund programs, services, and efforts to change systems so they work better for everyone. By listening to communities, developing leaders, and working toward racial equity and racial healing, we join partners to help children and families have the greatest opportunities for success. And in the spirit of joining partners and stakeholders to create opportunities for success, our session today, Building Common Ground Across Michigan with Children and Families at the Center, challenges to do just that. Michigan is often described as a purple state, but that label is not just about politics, it's about people. Whether you're in Detroit or the Upper Peninsula, whether you voted red or blue or did not vote at all, if you're a parent, you want the same things: good schools, safe neighborhoods, affordable child care, economic opportunity, and a future where your kids can thrive. These are not Democrat or Republican priorities. They are Michigan priorities. Yet somehow, these shared priorities and kitchen table issues, the things that keep parents up at night, get lost in partisan gridlock. And while leaders debate, children, families, and communities continue to wait for results. They wait for better schools, they wait for health services, and they wait for the support their families desperately need. And this wait is destabilizing and unsettling. Case in point, a statewide EPIC MRA poll supported by the W.K. Kellogg Foundation and the Steelcase Foundation reported that 56% of respondents said Michigan should be doing more to support families. Additionally, in that same poll, 69% of respondents agreed that Michigan families will be suffering more than individuals and many other groups from the increasing costs of basic necessities. Given this real-time reality in Michigan, today's conversation is grounded in this simple premise. When we center children and families, common ground becomes not only possible, but necessary. This panel is not about winning arguments. It is about advancing pragmatic solutions, honoring the values we all share, learning from what is working, and understanding how leaders across sectors can respond to Michiganders' clear demand for meaningful action and tangible outcomes. Over the next 50+ minutes, we'll explore how shared values and priorities can translate into durable policies, how cross-sector collaboration can reduce polarization, and what it would take to move from rhetoric to results, especially in a state where balance, compromise, and accountability matter. Our goal for you is to leave not just inspired, but equipped with ideas, examples, and a renewed commitment to putting children and families at the center of Michigan's future. And with that, I would like to invite our esteemed panel to the stage who will guide us through the discussion and hopefully leave relative breadcrumbs on how to identify and build common ground for Michigan families. First up, we have Elliot Haspel. Elliot is a senior fellow at Capita and a nationally recognized family policy expert and commentator specializing in child care issues. He's the author of Crawling Behind, America's Child Care Crisis and How to Fix It. He's also appeared on television as an analyst and is regularly sought out by journalists and has been quoted in media outlets such as NPR, The Guardian, and Time Magazine. Next, we have Andy Richards. Andy is the Chief Operating Officer of Duncan Aviation in Battle Creek. Prior to that, he held the position of Vice President of Completions and Modifications. Andy joined Duncan Aviation in 1997, working as a cabinet shop technician. He is also the author of a recent op-ed, Crane's op-ed, on how business, employees, and communities benefit when policymakers support early childhood. We also have Monique Stanton joining us. Monique is the President and Chief Executive Officer of the Michigan League for Public Policy. Monique has dedicated her career to promoting social justice and advancing equity in Michigan. She's committed to addressing economic inequality, advancing racial equity, and promoting the health and well-being of Michiganders through public policy change. And last but surely not least, we have our moderator for this session, Regina Bell. Regina serves as Chief Policy Officer at the Council of Michigan Foundation, where she leads a robust government relations and public policy structure that engages Michigan philanthropy, state and national policymakers through the convening, research, advocacy, and lobbying activities to advance systemic change. As a policy professional with over 20 years of experience, Regina works to leverage collective voice of Michigan philanthropy to equitably improve outcomes for Michigan communities. Please join me in welcoming to the stage for this discussion. Thank you.
Thank you so much, Yazeed. We really appreciate that for a great introduction. So before we kind of start off in terms of the panel conversation, there are just a couple of things I just want to reinforce some of the items that Yazeed mentioned, but also just bring to the attention of everybody in this room. There are 10 million people in this state, 10 million people that call Michigan home. And each and every single person, including everybody in this room who calls Michigan home, we are part of a family unit. We are part of a family unit that wants to ensure that Michigan is a place where our families can thrive. So we need to really keep that at the forefront of our minds as we engage in this conversation. From Detroit to the Upper Peninsula, from suburban communities to rural towns, Michiganders share common concerns around quality education, affordable childcare, safe neighborhoods, economic opportunity, and the future where children can thrive. So that's really what this conversation is about. And my hope is that everyone in this room walks away with some clear actionable steps that they can take when they leave this island, go back home to their respective communities, in bringing people together to identify common ground solutions as we think about a children and families agenda. So just really keep that in the back of your head. The other thing in terms of just, we have question cards on the table, so I want to make sure that folks, as the conversation is going on, if you have questions, please use those blue cards. Folks will be circulating to pick them up to ask our panelists. So without further ado, we're going to get into the conversation. So Monique, I think I'm going to start with you. Mm-hmm. Can you maybe just kind of set the context of what children and families are facing? What's the state of play here in Michigan?
So as we heard yesterday, I'm sure everyone in the room is aware of this, it's really hard for families right now. Right now, many people sort of wonder, what does it mean to live in poverty? For a single parent with 2 kids, it means earning just over $27,000 a year. I'm going to venture to say that everybody in this room makes substantially more than $27,000 a year. There's 13% of our population that's living in poverty. And then beyond that, we have 41% of our population in Michigan who are not making a survival budget. And that's roughly for a single parent with 2 kids, that's roughly $56,000 a year. So between those that are living in poverty and those that are just not making ends meet, that's 41% of our population. When we think about how much things cost, food prices have gone up 20%. A 2-bedroom apartment costs roughly $15,000. Parents and kids have barely enough to survive, let alone thrive and invest the things that give kids hope and care and set them up for a positive future. You know, earlier yesterday we were talking about the house is on fire. An important part of this conversation that is right now crashing and burning down is our social safety net. We have 2.5 million Michiganders that rely on Medicaid for their health care. We have 1 million people plus that rely on SNAP to access food. And these things are being decimated. So the safety net that's been designed to try to catch people is being quickly dismantled. Right now, only 2% of families that qualify for the Family Independence Program, or actually 2% of families that are living in poverty, actually access the Family Independence Program. Because many people actually make too much that are struggling to gain access to this. And so An essential part of building common ground in Michigan is doing things that can catch people and set them up for a better life.
Thank you. Elliot, you and your team have kind of come out with some research. So why does what Monique shares in terms of like the state of play, why should that matter to us? Why should we care?
Yeah, so a state is only as strong as its families. Families undergird everything, socially, economically, anything that we think of as making a strong state starts with families at the cornerstone of any state. And at Capita, which is an independent think tank, we did a survey of both 1,000 parents of minor children nationally, as well as 200 families specifically in Michigan. And what we found was that Michigan families are really struggling, even compared to a national baseline. So as one data point, 41% of Michigan parents reported in our survey that they'd either taken on debt, did use payday advance products, or they had had to take out that they had to borrow money in order to cover basic expenses over the past few months. And I'll caution, just as like a data point, because I'm a data nerd, like the margin of error here is like 7.7%, so don't take the exact numbers, but it was 41% of Michigan families compared to 29% of families nationally. So even with that margin of error, like it's a significant difference. And we see this across different measures. So significantly more Michigan families, around 40%, said that they had to take on more hours just to cover basic needs, not because they wanted to, than their national peers. And we also saw that 56% rather of Michigan parents said that they felt down, depressed, or hopeless at some point in the past 2 weeks, which compared to about 48% nationally. So again, we're just seeing this picture that says Michigan families are really under strain, and families across the nation are. But there seems to be a story here where there are some forces in Michigan in particular that are causing families to struggle, and that to me says there needs to be a real conversation about creating the enabling conditions for that thriving that you've been talking about, that there's something about the overarching structures here in Michigan that is just not working for far too many Michigander families.
Yeah, and when I think about the survey data and the 41% that you referenced that took on debt or used payday lending to be able to cover basic needs, and I think about some of the context that Monique set for Michigan, our families aren't thriving. And I don't know that we necessarily have created a pathway yet to get there. And so I am curious, Andy, from a business perspective, though, there are some tangible things that you've been working on, and I'd love for you to be able to share with our folks here in this room what that looks like.
Sure, thank you. And thanks for being here, having me be here today. It's a great honor to be on the panel. So Duncan Aviation, for those who don't know, has been around for 70 years. We have 3,500 employees, 850 of which are in Battle Creek, Michigan. And what we do is very much a for-profit business. We maintain, repair, and modify business jets. One of our values for the company is taking care of our families that work for us. And we do that in a few different ways in Battle Creek. One is very direct. So those can be, flexible shifts, coverage, ability to move to different shifts, start and stop time, flexibility, those types of basic things that a lot of companies do. But in addition to that, we've also added some additional benefits, certainly coming out of the pandemic when we really started to see the stress on our families. Benefits such as dependent care benefits that can be used for either elderly adults in the family or kids that are in child care. In addition, we've stood up about 12 years ago an in-house medical clinic to support the health of our families that work for us, because this health clinic has a full-time nurse practitioner as well as a full-time behavioral health therapist on staff, and all of our team members can use it, but not just our team members. Their spouses and dependents down to age 2 can use that for $20 a visit. So helping out with that health issue that can be causing stress on the families, as my panelists had laid out. In addition to those programs, we also know that we've got disabled young adults in our communities. And so we've been part of Project Search, which is an organization that helps those folks coming out of high school that have disabilities learn how to get a job and keep a job as interns at Duncan Aviation. So we've been part of that organization for 11 years now. And then in addition to all these other things, we also are growing leaders at Duncan Aviation, because leaders don't just lead within our company, they lead out in the community as well. At least that's the way we see their job. And so one of the higher level leadership training events we host or teach is we teach a class that talks about trauma-informed leadership. Because we know that in our communities today, people are facing trauma and stressors that interfere not only with their ability to thrive in their daily lives, but also to engage fully at work and grow careers that are meaningful to them and succeed. And so this trauma-informed leadership talks about influences like ACEs, like epigenetics, and like our community adverse experiences. And so we're hopeful that by growing these leaders' awareness of these stressors and perhaps traumas that our families are facing out in the communities, they can lead better both in our facility, leading their teams that show up there with some of these stressors in place, as well as go out into the community and spread the word and do some good work out there to help develop the community. So those are all things we're doing inside the company. But then we also have taken it a step further to go outside a company into the community. And so I've been working with organizations such as the Southwest Michigan Child Care Coalition and Pulse for the past 4 or 5 years, working on the child care deserts and crisis that we have in place in Battle Creek and Kalamazoo area where most of our families live. I've also been part of the initiative to stand up a RX Kids an RX Kids program for 4 communities in Calhoun County. It's not quite ready for prime time, but we're hopeful that very soon there will be an announcement that will kick off for those communities. But we put some money where our mouth is. We dedicated some funds towards the matching grant that was necessary to activate the state funds for RX Kids. So all these things that we do out in the community, and there's many more, are because we know that if we have a strong community, it's going to be a better place to host our business, as well as where our team members can build meaningful lives that feel like they're thriving in the community as well as at our workplace. It's time for employers to step up and take part in this action.
Yes.
Thank you, Andy, and it's a really important call to action, and I really appreciate the examples that you offered, because I think that creates kind of pathways for others in the business community to think about what they can do. I am really struck by the fact that we are operating in really difficult times, polarizing times, and thinking about the needs of children and families here in Michigan and how we actually reach common ground. So I'm really interested in understanding, and Monique, I'll maybe start with you, as you think about kind of this increased polarization, what are some of the shared values around children and families that we really should hold sacred as a state, as a community?
Well, first of all, poverty and struggling families aren't partisan. If you're living in poverty, you could be on either side of the aisle. Poverty doesn't care whether you are a Democrat or a Republican or an independent. Families and people are struggling. And when you think about some of the major policy things that we have done over the course of our history, they've been nonpartisan. People on both sides of the aisle support them. So our biggest anti-poverty program is a cash program. It's Social Security. People love Social Security. We have made policy choices that have done things concretely that have reduced poverty both in Michigan and nationally. And then we've also made choices to stop those things and cause poverty to go up. What people who are struggling in poverty need is cash. And there's lots of ways that we can get people cash, whether it's through boosting income, whether it's refundable tax credits, or if it's cash transfer programs like RX Kids. There are really bold policy solutions that we can make. So let's talk about the child tax credit. During COVID, we chose as a nation to cut childhood poverty in half. And then we made the opposite choice by not extending the child tax credit, and it went back to what it was. So many people in this room with kids probably qualify for the child tax credit because you earn enough to qualify. Right now, there are lots of people in our country and in Michigan who don't earn enough money and are too poor to qualify for the child tax credit, so they're not eligible for it. And we made that choice to not make that refundable. A bold policy issue that's taking place in Michigan right now is RX Kids. I know Dr. Mona's here. It's a cash transfer initiative. There's all kinds of great data around RX Kids. A family gets a $1,500 payment, cash payment in their third trimester of a mom's life. They get a $500 monthly payment after that. It's expanding across Michigan, and there's concrete data. Evictions go down, child maltreatment goes down. But one of the most important things I hear about that initiative and from moms is that it gives families a room to breathe. They can afford that winter coat, they can afford that camp for their older child, they have more time to spend and bond with their baby, and that is what families need and crave. And we can do these things if we choose to make really solid investments in kids and family. And that's how we turn Michigan around. If we want to build a better state that retains our population, that attracts new people here, we're going to invest in kids and we're going to make sure that we're reducing poverty in our state.
I would encourage everybody, there is a session that's taking place tomorrow on RX Kids, so would encourage folks to join that conversation. I'm really struck, Monique, by what you talked about in terms of giving families room to breathe.
Yeah.
You know, I don't know many of folks in this room who understand what it means to live paycheck to paycheck, but there are folks that are doing just that. And so, cash prescription programs are critical to be able to just help them to have the room to breathe, as Monique indicated. And then, you know, Elliot, as I think about the recent survey data that Capita did and thinking about not only the economics that are impacting families, but also how it's impacting behavioral kind of health. I'm wondering if you can kind of speak a little bit more to that, but also, what is it that we should be holding sacred as we think about common ground?
Yeah, I mean, I think the fact is, and this is, I love RX Kids, and I basically want to double underline what Monique just said, that this idea of stability, predictability, and quality of family life, as we do this work around the country, like we keep hearing that theme come up over and over and over again. It's true here in Michigan, it's true in other states, and what you often hear when you talk to parents is this idea of, I want not just the money to be able to pay rent at the end of the month, like I want the time to be able to make memories with my children. I want to be able to go to their games and their plays. Right? I want to be able to go to the beach with them. I want to be able to have this time to pass on stories and traditions. And you know, if for a person of faith, to go to faith communities with them. Like all of these things that make up, I mean, sort of in a very ancient way, the good life. And when you don't have that, there's this discontinuity, it does lead to psychological distress. And we know that that's both like an acute stress in the sense of adverse childhood experiences and in terms of chronic stress happening to the brain, but it's also a more existential stress. And I think we're seeing this in the atomization and the disconnection that we're across Michigan and across the country as parents become increasingly isolated. You all may remember, the Surgeon General a few years back put out an advisory about parent mental health, and calling it basically a crisis, that we are seeing parents become increasingly isolated. And again, I think this is very true across ideological grounds, across geographic grounds. So being able to start with that idea, and I go back to what Yazeed said at the beginning, right? Like we all need these very basic things to be able to live the lives we want to live, can really be an imperative that we can build off of, because there is common ground there.
Yeah, appreciate that. Andy, I am wondering, as you think about the work that your organization's been leading and what you think about the call to action is for various business audiences. I'm really wondering how you think about the inclusion of those with lived experiences in identifying solutions. One of those things that philanthropy, nonprofits that we often talk about is those that are closest to the issues also should be really at the decision-making tables when we're talking about solutions. And so I'm just thinking about, how have you and what advice might you give to others in the business community about really being mindful of the inclusion of those with lived experiences?
Thank you. Great question. So lived experiences, my colleagues up here have done a great job providing the data of what families are feeling in Michigan. And so some of us as employers may say, that's not me, that's just the statewide average. We're doing it much better in my company, right? Things are much better here. Well, I think if you're having those thoughts, you owe it to your employees and to yourself as a company to ask them directly. What is their life like? What experiences or challenges are they facing out in the community? And so that's what we've done. About 5 years ago, with the help of the W.E. Upjohn Institute, Pulse, and the Battle Creek Unlimited organization, we conducted a survey of our employees about childcare. What are your challenges with childcare? What would help with those challenges? We completed that survey, we went over the results, and what we found was it aligned very well with what my colleagues up here have stated about the challenges families are facing. So we dug in a little bit deeper because we got curious. Okay, so it was an anonymous survey. Let's hear from some real folks directly what's going on. And so we convened over the past 3 years 3 different listening sessions with our team members. And the last one was just last week. Because I thought, I'm coming up to the policy conference, I want to get some real-time information. Is it still just as bad as it has been? And so during this session, I heard a few different things that startled me. So back when we had one of the first listening sessions, I heard about year-long wait lists to get into a child care facility. Now, last week, I heard from folks that it's 1 to 2 years to get into a child care facility, a quality, licensed child care facility. And so what are they doing to make ends meet when they can't get in? Well, they're cobbling together care for their kids using friends and family members who probably also have jobs that they need to go to or wish they could go to if they weren't providing that care. And then sometimes these caregivers get sick, and so child care falls through. And then what happens at Duncan Aviation? They miss work. We lose productivity. This is a workforce development issue. It's a workforce participation issue that's affecting the state. If you were at the Houses on Fire session at 5 o'clock yesterday that Monique referenced, workforce participation and then also movement into the state is also in the 40s, I think it was. I think as far as population growth, we were 50. And so why is this? Because families are struggling is one of the reasons. Okay, so in addition to not being able to find child care, it's not affordable if they can find it. One of these team members in the session last week said that he's got 2 kids in child care and he's paying $500 a week for that care. That's a second mortgage, easily. And so you might say, well, Andy, if you would just pay a living wage, he wouldn't have that problem. We can debate what a living wage is, but I'm here to tell you he makes more than $30 an hour and he has a spouse that also works full time. So it's not about that I'm not doing enough. Certainly we can do more as employers, and we're always looking for more ways to do more. Another thing I heard in the same session was, I asked, we had 20 families in the room, by the way. I asked for a show of hands. Who has either thought about leaving the workforce because of child care issues, or has had your spouse think about leaving the workforce? 2/3 of the hands went up. In addition, I also know that I've lost 10 team members from just one department in the past year due to child care issues or challenges. That's 10 team members from a 200-member department out of 850. So for that department, that's 5% of my turnover, because I had 10% last year. Sorry, 5% turnover, so half of the turnover, because I had 10% overall in that department. This is a significant workforce development issue. It bears repeating. And we all have to engage in that. So these lived experiences should inform our actions. And hopefully you can see the tiebacks to my earlier answer about things we've put in place to try and relieve some of this stress on our team members when it comes just to this one issue of childcare.
I really appreciate the lived experiences being, tying those things back to the actions that we actually take. And so, Monique, I am curious to know, as we think about lived experiences and making sure that those that are closest to the issue are also closest to making decisions about how we address those issues, I can't help but to think about policymakers. And we have some trade-offs because we also recognize that we don't have an infinite amount of resources available. We have a finite amount of resources available, and so there are often trade-offs about where we need to invest as we think about a children and families agenda. So what kind of advice or what would you say to policymakers who are thinking about kind of these trade-offs?
So at the League, we believe that our state budget and our federal budget are moral documents. They tell us who we value, what we value, and oftentimes who we don't value. And so I go back to the idea of trade-off. I don't think it needs to be a trade-off in terms of good policy that will support families and good economic development. Andy is speaking as an employer. It is critical to have access to childcare if we want good labor participation rates. If we want to transform our cities, it's not only about making cool downtowns. I love downtowns. I live in Detroit. I love a big city. It's also addressing the systemic issues that families are facing. We need to do more to give kids hope, to get them connected to resources, to give them ideas about career paths. We need to invest in our schools. When we talk about school investment, while we've made huge transformations in Michigan over the last couple of years, we still, if we had kept up with inflation, are spending less on our schools than we did 15 plus years ago. And if we had kept up with some of these types of transformational investments, we'd be in a different place. And we have to really think about what we're choosing to invest in, and by investing in our kids and our families, that's sound economic policy. That's making sure that families can get to work. It's paying good wages. It's paying paid family leave so families can have those essential moments and be with their family if they're, if a family member's dying or if a child, a new baby is coming home. These are all essential things that will make Michigan a wonderful place to be and keep people here. So it doesn't have to be a trade-off. Families, whether you're red or blue, Democrat, Republican, or independent, want support, and these don't have to be partisan issues.
Thank you for kind of that kind of reframing of this trade-off piece. And one thing we hadn't talked about, but I am a little bit curious. For each one of you, as we think about a children and families agenda or an agenda, a policy agenda that puts children and families first, what would you say should be in that? What's part of that agenda? I'm gonna start with you, Elliot.
Okay. Well, we'll not shock anyone to hear that childcare is high on my list. I think that undergirds a lot of things. But honestly, I'd like to take a step back because childcare sort of nests under this idea of family policy. We don't talk actually about family policy as much as we talk about discrete policies. Here's paid family leave, and here's childcare, right? And here's the child tax credit, and here are all these different things. But the question of what is the goal we're actually heading towards, like what is the vision that knits all of these things together, is a really important one, because I will say it brings up different things. Something I've been doing some work on recently is this idea of like predictable job schedules. If you don't know what your job schedule is going to be 2 weeks in advance, do you know how hard it is to secure childcare? There could be a slot next door that is affordable for you and available for you, but you can't take it because they're going to require you to pay for the whole month, because of course they're going to require you to pay for the whole month. They have to make their payroll, but you don't know, if you're going to be able to, when you're going to need childcare. You don't know what your income is going to be up and down. And so that question of predictable schedules, and people have different views on it, and that's totally fine. But I bring it up as an example of something that usually sits in the world of labor policy. It's traditionally been taken up as a question of like labor versus management, like as a labor policy issue. I would reframe it as it's a family policy issue. And there's a scholar, Karen Bogenschneider, who talks about like you can take a family lens to most issues, and you can apply family impact statements to most policy issues. And when you start to really see, and truly just to the point of this session, put families and children at the center, it can actually break barriers down. You create really fascinating political alliances that we may not otherwise get if we just take issues in their silos.
Yeah, I was thinking about yesterday housing session and how much having affordable housing is critical to a family, right? And so these things, we often have conversations in silos about these issues, but for a family, they're impacting, like it's everything combined. It's not just this one thing, it's all of the things, right? So Andy, what should be in that agenda?
Well, we all want a vibrant business community, okay, where lots of people can get jobs if they want them, and they have the supports in place to help them get those jobs, keep those jobs as they thrive in Michigan. So cross-sector collaboration that's sustainable is very important, and it has to include all of the players. So for instance, I've been working with, employers should be working with community support organizations. They should be working with economic development organizations. They should be working with their public officials to work on solutions together that are sustainable. And the way it can be sustainable is to provide some structure to it with an accountable lead who's taking charge of this, setting up a structure of regular meetings where these collaborators can come together on a regular basis like we have at the Southwest Michigan Child Care Coalition with the support of the ECIC, and keep on it. We've all got this shared vision. We all want to thrive in this community, but we've got to do it in a structured way. We have to harness all of the energy that's out there because there's a lot of great things happening, a lot of good discussions that are happening out in these communities, but we need to bring them all together so we have some collective power, and we've got some organization to it as well. So not only cross-sector collaboration, but also a structure that creates some unity and some direction to focus that energy.
So it's all of this. Families are experiencing all of these things at once. They don't think about my housing need, my healthcare need, my food need, my childcare need. It's all of the things. So at top of our list would be a refundable child tax credit that includes people that are poor and are living in poverty. It includes access to childcare that pays good wages for childcare workers, so the people that are doing this essential work that's skilled are getting paid adequately for it. It includes access to healthcare for children and families and immigrants. We know because of the HR1 changes, access to healthcare is going to have a significant rollback. That's already happening, and people need healthcare in order to be healthy, support their families, and to be able to participate in the workforce. And then access to food, whether it's through SNAP, 10 cents a meal programs, free school and lunches. People need food, especially in the face of such steep rising costs.
Mm-hmm. I want to encourage everybody, if you have not, please utilize the blue cards to actually write down your questions. There will be folks to collect those. So please make sure to do that. If we really look at policies through a family lens, and are committed to doing that and really thinking about what's the impact of said policy on families and what will it mean for families across Michigan. I think that's a really good takeaway from this conversation. But I am also curious because many of us would say that we've done that. So, and we know that good ideas often stall. And so I'm kind of curious, why do you think that is? Yeah. But also, where do you see spaces and places across the country where some of these things that you've talked about should be in a children and families kind of policy agenda where you've seen those things kind of excel or take off? So I'm gonna start with you, Elliot.
Yeah, so there's an old political scientist, John Kingdon, who has this theory, and it basically says policy windows are when policy change happens. And to open a policy window, like, you usually need three things. One is you need a problem that is framed in such a way as it is resonant, right? You need a solution that is available and that is palatable, and you need politics to align, because politicians make political decisions because they're politicians. And when those three things happen, you can see change happen incredibly rapidly. It's sort of this punctuated equilibrium idea, right? Like, it kind of feels like nothing is happening, nothing's happening, and then suddenly, like, oh great, like, we have healthcare or whatever it is, we have Social Security. And so I think some of the reason that things stall is because we're kind of hitting a barrier on one of those three streams. Sometimes the politics is just wrong. If you go to the really, really red state or a really, really blue state, you're just not gonna pass the opposite policy. Fine. But in a lot of cases, it's because we're making an argument that isn't reaching the moment, or we're framing things too narrowly. And I'll use childcare as an example because it's what I know best. Childcare is an economic imperative. It absolutely is, and we should keep saying that. We need to keep making the case. I will tell you, I have sat in rooms full of community members to whom that is completely uncompelling, but I have sat in a room full of community members who you would never think would want to support, like, government intervention in childcare, but who, when the police chief gets up there and says, I can't keep enough officers on the beat to respond when you call 911, they sit up straight. Right? There's an extraordinarily conservative town in northern Minnesota that ended up passing a sales tax on itself a couple years back to buy the only child care center in town that was closing and to convert it into and then hand it over to a nonprofit, right? And, like, you get these and part of that is because, like, we're not going to have any families left. We are a small rural town that is literally going to not exist in a couple of generations if we don't do something about childcare. And it ties into economics and ties into family support. But again, the way people arrive at these issues, the framing is really, really important. And sometimes one I see is that we are not thinking expansively enough. We're not trying to sort of be entrepreneurial enough in the way that we're framing these questions, because people come to these issues in many, many different ways, and we need to reach them in those different ways that resonate with them. So I think that's one piece of the challenge. The other place where I see this go well is often when you can identify some kind of dedicated funding source, right? So I'll use childcare as one more example. When you look at New Mexico, which I'm sure all of you probably know, as recently became the first state to offer universal free childcare, the reason they could do that is because they had basically oil and gas revenues, and not every state has that. Vermont, though, went ahead and Vermont passed a very small payroll tax, and they used that to fund it. Like, we've seen Washington State use a capital gains tax. Like, different places, it's not ever gonna look the same, but there was a very hard conversations I had about how do we actually pay for this? What's the very, like, sophisticated economic analysis that, to Andy's point, says this is how much we're actually going to get back. This is how much we're going to get back in state GDP increase. This is how much we're actually going to get back in state tax receipts. Right? We can do those analyses. We have the tools, and then you have level ground to have a conversation about the trade-offs that you and Monique were talking about. And I think the more that we can kind of get down to brass tacks once we've framed the problem in the right way, because that's the policy kind of stream, then we're on our way. So when I see states be more successful, it's because they're really thinking strategically about, I'm not just going to make the argument and say the line or say how expensive childcare is over and over and over again. If that's not working, maybe that is working, but we do see sometimes I think an over sort of indexing on the idea that if we just make the factual argument enough times in enough rooms, we're going to break through. And unfortunately, that is not what experience bears out.
Monique, so same question to you. So what do you think are some of the barriers, like here or to our agenda, and then where have you seen things working well?
Right. So 70% of people are concerned about federal cuts in Michigan. That shows you that these are not partisan issues. And we need to recognize that people and what they're thinking about isn't partisan. It's not always red or blue. Sometimes the message gets lost in the politics of it. So going back to what Elliot says, from the league's perspective, we need to have real conversations about revenue. Michigan is not a high tax state. So we need to think about where our revenues are and how we're using those revenues is essential. The governor proposed, for instance, some increased taxes on vaping, on gambling to help fund Medicaid. So there's a public health benefit, a revenue benefit, and that would make our Medicaid system more robust in this moment. So those are uncomfortable conversations, especially at a policy conference like this, but it's something that we really need to lean into. Aside from that, Michigan, as a purple state, has done bold things. We expanded Healthy Michigan, which was a part of Obamacare under Governor Rick Snyder, a Republican. It had good bipartisan support. When we did that, we cut uncompensated healthcare costs in Michigan by half. We are in the midst of rolling back Medicaid expansion because of H.R. 1 and federal changes. We don't have to do that. We know healthcare is not bipartisan. In Michigan, we expanded the earned income tax credit from, I think it was 6 or 7% up to 30%. We quintupled that. That helped alleviate people from poverty. That was also bipartisan. RX Kids, something that's happening right now, has major support. The Michigan League for Public Policy, we support it. On the opposite side, the Mackinac Center also supports it. That doesn't happen very often. And so these are things that we can see making real change in people's lives that have widespread support across all sides of the aisle.
And I would say that, as we talk about RX Kids, Michigan philanthropy has been walking really side by side related to RX Kids, and it was, first piloted in Flint. And I know Dr. Mona's in the room, and as I indicated earlier, there's going to be a session tomorrow that will focus on some of the lessons that learned from that. But I would say that philanthropy, it's but one example of how philanthropy has partnered with government, with business, to really kind of test new, innovative ideas to support children and families in this state. But we certainly cannot kind of do it alone, and it does require partnership, and it does require us being able to reach common ground and really thinking about putting children and families first in every policy decision making that we move forward with. So I'm really pleased with the work that philanthropy has been doing, but I know that there is so much more that we can accomplish through working together. So I do want to maybe
Regina,
ask
can
all of y'all. Sure,
Can
Monique.
it happen there? So right now, we know the social safety net is rolling back. RX Kids is a wonderful example of a creative use and partnership between philanthropy, nonprofits, academic, business organizations. There's chatter right now that philanthropy can just fill the gap from the federal government. They can't. If philanthropy spent all of its dollars, all of its endowments, I think it's 78 days we would make it, to plug that hole. That's not enough. And so it's going to require really creative thinking, ways to use public investments, private investments, nonprofits, and philanthropic investments to make sure that families are whole and are thriving in Michigan and across our country.
Yeah, that's, again, a really important point. And even to bring it to thinking about it from a state perspective, Michigan Philanthropy grants $2.1 billion annually, and SNAP benefits for families equates to $3 billion annually. But one safety net program we wouldn't be able to afford if we were just working and relying on philanthropy alone. So there is one question as we kind of near the end of our time, and then I get to audience questions. There is one question that I want to ask each one of you. I'm really curious about what are the one or two actions that you would encourage folks in this room to walk away taking. One of the things that I'm always kind of about, Mackinac at times is, we have these great conversations, but then we go back home and we kind of get back into our normal rhythm of our daily lives. What are the action steps that you want folks to walk away with and really hold themselves accountable to?
Yeah, I'll say two. First is to the point of common ground. On a very human level, like we have become so sorted away from one another. We've become so disconnected from one another. So my encouragement would be to go to communities that you're not like the ones that you necessarily live in and talk to people, right? Like, I mean, to end your point about like having like the roundtable with parents, and I love doing the roundtable with parents at Capita. Anytime you can sit down with a group of parents, and parents are generally pretty happy to talk to you. You can go through intermediary organizations, of course, but just to hear like what is going on, what are their experiences, and I think particularly if it is in a community that is different than the one you live in, that to me you start to get that common ground. You hear the themes across, I hear that in my community, I'm hearing this in this other community. It also just gives you a chance to really kind of test out some ideas. So that's thing number one. Thing number two, I would say, is in whatever work you're doing, to be able to start applying that family lens, this idea of how are the decisions that I'm making, whatever world I'm living in, affecting families, particularly families with children, and what are the ways that I might be able to create connective tissue with other areas. I think that would be another, because we are so siloed, even within childcare. I would say very good, like early childcare and school-age childcare. It's basically, kids don't magically stop having childcare needs when they enter kindergarten. They change, but they aren't magically changed. We treat them as separate things. We treat paid family leave as something separate than early childcare, something separate than school-age childcare. So even within like very discrete policy areas, there are silos, much less across what you were saying, like housing and transportation and all these other things. So that would be my other encouragement is like, reach out across issue areas, figure out how you can bring a family lens to your work, and that's going to, I think, make your work more effective, and it will ultimately help the people you're trying to help.
Andy?
Okay, employers need to get involved, both inside your company and outside your company. Not every company is going to be able to do what we've done inside our company, understood, but you have the ability to listen to your team members, right? Everybody has that ability. And then you can take that information that you've gleaned from your team members and take it out into the community. And then you can work with the experts that are on stage with me, as well as, in my case, the Child Care Coalition for Southwest Michigan. There are 10 child care coalitions across the state, one for the UP and 9 for the lower, and you've got one. And they're the experts. Ours is convened by Pulse, huge experts in this field, and there's others out there that you can work with. They can give you ideas on how you might be able to make things a little bit easier for your team members. They have the roadmap that they've put together. You've got a flyer on your table. Scan the QR code. It'll take you to not only the cover document, but then there's additional links to the Pulse roadmap, as well as a MyLeap document that talks about the stats, talking about the state's challenges with childcare specifically. So get involved is my main message.
So number one, I think this is a theme through all of ours, is to talk to somebody. Talk to somebody that you would not normally interact with, maybe somebody that is typically on the perceived other side of the aisle from you, and actually listen to what their concerns are, rather than just trying to make sure that you're getting your message across. I think if we want to build common ground and we want to create action, you really need to start with listening to people that are struggling. And two, I don't think it would be a conversation without the league, without a mention of tax. It is so important to understand how tax policy and the budget policy making process work in Michigan if we want to create change. So really, I encourage you to get educated and really develop a deeper understanding of how tax policy impacts all the things that we're trying to work on.
Thank you. I want to transition to some of the questions from the audience, and then we'll come back to kind of what your one or two items were for the audience to walk away with. But Andy, this one's for you. Can you kind of talk a little bit about the why for Duncan, what the return on investment is? How can or do you justify the investment that you're making? And also, do you think that it's scalable for other businesses?
So the return on investment is engagement, first and foremost. When they're there, they feel like they're part of our family and that we care about them. And that will give you dividends. That will return dividends to you as a business through productivity and through quality of work. And then there's also just absenteeism, right? As I mentioned earlier, when child care falls through or there's some other stressor in the family, they have to go to a healthcare appointment, that takes them far away, then they're not present, right? If they're having to deal with sick kids at home or they're sick themselves, they can't participate because maybe they don't have the money or the access to health care like they need to. So these are really tangible benefits, this productivity as well as participation in the workforce. So we think that it's well worth the price that we pay for those benefits and the attention we're paying to these issues. You know, I take a lot of time to do this, so are other leaders in my company taking time to do it, but we know it's well spent resources, because not only is it a better place in our company, but as I said, it's also a better community if we're working to build those community resources as well, so that they have the ability to show up at work, participate fully without worrying about things that are stressing their families.
Okay. So this one's for any of you. How do you feel paid family leave would address the issues families are facing? And maybe Monique, I might look to you to tackle that one first.
Sure. So paid family leave is essential. We often think about it only when a family, a mom or a dad is having a new baby and bringing a baby home. That's an important, critical bonding time. And if you've had a baby, it's an important time to take care of your health. Two, in the really hard moments of life, if you have a spouse or a child or a parent that's dying of cancer, you shouldn't have to be able to worry about whether you're going to be able to afford rent. And so we want people to have time off when the joyful moments are taking place and the really hard moments. There's also positive economic data around paid family leave, shows higher labor participation rates, long-term participation in the workforce, and so there's a concrete economic reasons to do it as well. So there's great models, and it's something that Michigan, as well as nationally, we want to make sure that we can do to give families the opportunity to be there for themselves and their loved ones in the really joyful and hard times.
Can I also add on to that too?
Sure.
Like, I think, just to underline, like, I think sometimes we talk about paid family leave as being important and we lose it is barbaric. 1 in 4 American women are back at work within 2 weeks of having a child. I haven't had a child, my wife has, and 1 in 4 women are back at work within 2 weeks of having a child. Do you know how many countries other than the United States don't have a national maternity leave? Papua New Guinea and a bunch of Pacific islands. That's it. We are a complete outlier, and I think sometimes we just say, oh, this is just the way it is. It is not the way it is, not the way it should be. It is a morally abhorrent that we're doing that. So yes, it absolutely, everything to what you said, and also I think we need to have stronger language around it, quite honestly. And if we want to...